Namaste. Welcome you all for the yoga session. In this session, we are going to use a chair, a mat, and a blanket. We are going to do Uttita Trikonasana with the help of a chair. Before that, we shall go through some preliminary postures for the core muscles using the chair. Lay on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back. That should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Now relax both the arms. Keep them by the side of the trunk, palm facing down. As you inhale, rise both arms up over the head. Then as you exhale, bring it back. Match the action of the breathing. Feel the weight of the arms as you move them up and down. Inhale up. At the end of the inhalation, it should have reached the ground again over the head. Then as you exhale, bring it back, taking the palm to the sides of the trunk. And at the end of the exhalation, the palm should land on the mat. Match your breathing and the action. This is good for the scapular region, the shoulder joint and the arms. A good way to also improve the depth of inhalation and exhalation. Also feel the position of the arms. Especially when you close the eyes, you must feel from within the position of the arms as they move up and down. That is, our ability of proprioception improves if we are able to move them as synchronously as possible. As you inhale, you must lift the arms and also ensure that as you inhale, the abdominal cavity expands. Then as you exhale, contract the abdominal muscles and also move the arms. Watch the shoulder joints. Watch the scapular region. Watch the chest. chin towards the chest. Feel your arms. Feel the weight of the arms as you move them up and down. Now relax the arms. You can fold the elbows, resting the palms on the abdomen and chest. Rise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch at the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very attentively be done. Left leg down. Relax your breathing, watch your back, rise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest but ensure that the hip, knee and ankle, they are all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles a little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh from left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible, then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull powerfully and then push across the chest. Feel the stretch in the gluteal region, especially the gluteal maximus muscle gets a good stretch in this posture. Breathe well. Be aware of your breath. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. The gluteal maximus muscle is one of the major muscles of our body, so this posture gives a good and intense stretch for the gluteal maximus muscles. You have to push the knee across the chest so that you get a more penetrating stretch. Release left leg. One more time. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the complete hip musculature. Feel the muscles of the lower back. To feel the muscles of the lower back or the posterior surface, you should use your breathing to sensitize that region. Release right leg, left leg. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. So this posture is also one of the very important postures for the health of the back. Release left leg. Just watch the posterior surface, the region of the lower back. Right leg fold, resting the heel on the left knee, then from left hand pull the left thigh and from right hand push the right knee. And you have to stretch the heel, both the heels, toes towards the knee. Feel the root of the or base of the right hip deep inside. You should get a good stretch. You must pull the left thigh. Now release the left thigh, then rest the right leg also on the chair. Fold your left leg, resting the left ankle right on the knee. From right hand, pull the right thigh, from left hand, push the left knee. You have to pull the thigh so that the heel is almost at the edge of the seat of the chair, and tighten the hamstrings. Breathe well. Feel the stretch deep inside the left hip. Release right leg. Rest the left leg also on the chair. One more time. Fold right leg, resting the heel on the left knee. From left hand, pull the left thigh. From right hand, push the knee. Breathe well. So this is a good stretch for the so-called piriformis muscle, which is located deep in the hip, and the sciatica nerve passes adjacent to this. Therefore this stretch is also very useful. Release the legs, rest the legs on top of the chair, chain, fold left leg, left ankle on right knee, from right hand, hold the right thigh, pull From left hand, push the left knee. Keep both heels active, toes towards the knee, and breathe well. Feel the complete region of the hip. Release right leg, then rest the left leg also on the seat of the chair. Rise both legs up, hold the knee, press the knee closer to the chest. Stretch the heel, toes towards the knee. Knee as close to the chest as possible. Breathe well. Here the abdominal cavity. During inhalation, feels a better massaging effect because of the pressure of the thigh, and because of the same reason the thoracolumbar fascia, the thick skin at the back, that responds better to the breathing. Just watch that region as you inhale, exhale. Also here, tighten the back of the thigh, both legs, so that you can feel the knee capsule. The outer covering of the knee also gets enhanced stretch. Or release the legs, rest them on the chair, breathing relaxed. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side. Sit on your heel and sit upright. Hold the chair, take your right leg forward, hold the chair and flex the right knee as much as possible. Chest and navel up. Keep the left leg in line. Do not deviate the left foot. Chest and navel up. Ensure that the complete right foot is pressed. Tighten the right hamstring muscle also. Feel the knee capsule. Chair should give you a good orientation, a good sense of direction for the trunk, so that the pelvis is kept in balance. Feel the hips, feel the lower back. Breathe well. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Slowly come up. Take your right leg back. Then chain. Left leg forward. Then as you exhale, flex the left knee. as much as possible. Chest and navel up. Use the chair to get a good sense of direction. As you can observe, the left hip is in flexion, right hip is in extension. This is also a good posture for the hip flexors. Also very useful for the base of the spine. So these postures should make the practice of Trikonasana better. Slowly get up, take your left leg back, sit on your heel. Watch your breathing. The chair helps a lot in all phases of practice. Stand up in Tadasana, chair to your right side, turn the right foot 90 degrees out, left foot in, and spread both the legs about 4 feet apart. Initially flex the right knee a bit, both hands on the waistline, stretch your right hand, bend to the side, rest the right wrist on the top of the chair. Keep the right leg bent and note the position of the right foot. It is right below the seat of the chair. Right leg straight, slowly. Pull both the kneecaps. Press the outer edge of the left foot. Right foot should center the left foot. Stretch the trunk. The chair helps as a good support and also places a limit for the lateral flexion or lateral bending of the trunk. Press the right foot evenly, even pressure on the inner and outer ankle. Pull the kneecap. Push the root of the right thigh down, create more space and freedom for the trunk. And turn the right thigh out. Turn the left thigh out. Slowly come up. Join the foot. Change side. Left foot 90 degrees out, right foot inside. Left foot should center the right foot. Press the outer edge of the right foot. For that you have to roll the right thigh out. Both hands on the waistline. Left foot to the center of the right foot. Stretch your left hand. Rest the left wrist on top of the chair with left leg bent. Right hand on the waistline. Press the left foot. Gradually straighten the left leg. Stretch the trunk. Push the root of the left thigh down and stretch the trunk. And roll the pelvis. For that you have to externally rotate the right leg. Ensure that the legs and the trunk are in the same plane. Press the outer edge of the right foot. Increase the arch at the right foot. And breathe well. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Slowly come up. Join the legs. Knee on the blanket, sit on your heel, sit upright. The mobility of the muscles in and around the lumbar, pelvis and hip is very crucial for these standing postures. As such, we are going to add few postures which are targeted to stretch some of these crucial muscles. Kneel down, right leg forward, lean forward, hold the toe of the chair, stretch the right leg forward, taking the foot to the lower rib of the chair, keep the right leg slightly bent, well open the chest, hold the toe of the chair, chest and navel up. Push the heel down and pull it closer to you so that you activate the right hamstring muscles. But do not allow the heel to slide. Now gently straighten the right leg. Pull the kneecap, stretch the heel, push the root of the right thigh down, lift the trunk and navel up. You can feel an intense stretch at the back of the thigh, right thigh, the hamstring muscles. Keep on pulling the kneecap, chest and navel up. So this hamstring stretch is very useful even for the back muscles. Slowly take your right leg back, change side, left leg forward, left knee slightly bent, left foot against the lower rib of the chair with left knee bent. Push the left heel down and pull it towards you so that you engage the hamstring group of muscles. Hold the chair, lift the chest and navel up. Watch your breathing. Then slowly straighten the left leg. Pull the kneecap, tighten the quadriceps, push the root of the left thigh down. So using the chair this way, you can orient the trunk properly, you get a good support for the trunk through the arms of the chair, you get a good support for the foot, so that in effect you can engage the hamstring muscles properly. Slowly take your left leg back, sit on your heel, sit upright, watch your breathing. Stand up in third asana. We are going to again do Trikonasana. Right leg 90 degrees out, left foot inside, right foot below the seat of the chair, both hands on the waistline, both legs straight, right foot to the center of the left foot, stretch your right hand, inhale, exhale, stretch and bend. Now try to rest the palm on the seat of the chair. Left hand on the waistline, turn the pelvis out so that both the hips are kept even. Breathe well. Pull the kneecap, push the root of the right thigh down, so that you can further stretch the trunk. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Breathe properly, get connected with your breath and stay with your posture. Slowly come up, join the foot, change side. Left foot 90 degrees out, right foot inside. Turn the right foot slightly in and press the outer edge of the right foot. For that you have to roll the right thigh out, both hands on the waistline. Stretch your left hand. Inhale, exhale, gently bend. Rest the left palm on the seat of the chair. Roll the pelvis so that the legs, hips, trunk, they all get aligned in one single plane. You can rotate the neck, look up. Keep the left hand absolutely straight. Squeeze the muscles of the upper arm. Press the palm on the chair. Even pressure on the left inner and outer ankle. Slowly come up. Join both the legs. Knee on the blanket, sit on your heel in Vajrasana, sit upright. Vajrasana is again very good for the complete spinal region. It also helps your foot, knee, ankle. Slowly get up. Sit on the chair, sit upright. Sit to your right side, chest and navel up. Hold the top of the chair, inhale, exhale, turn. Twist the trunk. Turn the neck also in the direction of the twist. Both shoulders even, elbows closer to the trunk. Breathe properly. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Twisting postures help the standing postures in the sense proper twisting postures enforces proper alignment of the trunk in the standing postures. You have to stretch the spine, twist the spine and breathe properly. Slowly come up, change side, sit to your left side, chest and navel up. Hold the top of the chair, inhale, exhale, turn. Twisting postures further help to elevate or reduce the stiffness in the lower back as well as the upper back. It gives good freedom for the rotators of the spinal column, and this would help in aligning the trunk in the standing postures. Press the foot, turn the trunk. Do not allow the spine to flex. Slowly come up. Sit upright. Stand in third asana. Chair to your right side. Trikonasana again. Right foot 90 degrees out, left foot inside. Right foot below the seat of the chair, both hands on the waistline. Pull the kneecap, chest and navel up. Stretch your right hand, slowly bend, flex the elbow and press the complete elbow on the seat of the chair. Keep on pulling the kneecap. Roll the pelvis to align the trunk with the lower extremities properly. Roll the left shoulder also. Turn the neck, look up. Keep on pulling the kneecap. We are gradually increasing the degree of lateral flexion or lateral bending of the trunk, as you may notice. But in all these, you should ensure to align the trunk and the legs properly. Slowly come up, both hands on the waistline, join the foot, change side. Trikonasana is very good for the muscles of the lower extremities as well as the trunk. Left foot 90 degrees out, left foot below the seat of the chair, right foot 4 to 4.5 foot away and turn slightly inward. Press the outer edge of the right foot, both hands on the waistline, chest and navel up. Stretch your left arm. Slowly bend to your left side. Keep the palm, then flex the elbows. Rest the elbows on the seat of the chair. Roll the right shoulder, right pelvis. And be strong on both the legs. Push the root of the left thigh down. Tighten the quadriceps. Pull the kneecap. Turn the neck, look up. Be present. You have to focus on your breath and on the posture. Slowly come up, foot parallel, come back to third asana. Sit on your heel, Vajrasana. In case it is difficult to increase the lateral bending, one can repeat the earlier techniques till you find comfort. Take out the blanket, lie on your chest, keeping the chair in front. Rest the wrist on the seat of the chair. Particularly the wrist should coincide with the edge of the seat. And press the palm on the seat of the chair. Straighten both arms. Relax the neck so that the forehead can come close to the ground or it can rest on the mat. Stretch the toes, tighten the calf muscles. This is a good movement for the flexion of the shoulders. The scapulae move closer to the spine. The arms get a good stretch. Flex the arms, relax. Press the palms, slowly get up. Sit on your heel, Vajrasana. Sitting on the heel definitely helps the complete architecture of the foot. All the minute bones and joints there and multitude of muscles and ligaments in the foot gets rejuvenated in Vajrasana. Be seated upright. Stand in Trikonasana. Join the heel, join the big toe, chair to your right side. Right foot 90 degrees out. Take the right foot below the seat of the chair. Left leg apart. Turn the left foot in. Both hand on the waistline. Stretch your right hand. Inhale, exhale, bend. Flex the right elbow, place the right elbow on the seat of the chair. Now stretch your left hand up, palm facing forward. Turn the neck, look up at your left palm. Push the root of the right thigh down. Stretch the trunk. You have to laterally bend as well as stretch the trunk. And keep the ribs soft. Do not poke the rib cage. So you have to, when you stretch the arm, you must be very careful not to pinch the ribs. Slowly come up. Left hand on the waistline. Slowly come up. Join the legs, Trikonasana. Change side. Left foot 90 degrees out, take the left foot below the seat of the chair, right foot 4 to 4.5 foot away, both hand on the waistline, chest and navel up. Left hand stretched, flex the left elbow, rest the elbow on the seat of the chair, roll the right shoulder back, then stretch your right hand up and look up at your right palm. Keep on pulling the kneecap. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Press the outer edge of the right foot. Even pressure on the left inner and outer ankle. Align the trunk properly. Do not allow the pelvis to roll out of plane. So to orient the lumbar, pelvis and hip properly. Flex your right hand. Slowly come up. Join the foot. Trikonasana. Sit on the chair, sit upright, chest and navel up. Eyes gently closed, palm should face upwards. Tip of the thumb and index finger in contact. Rest the foot properly on the mat. Now we are going to do forced exhalation, automatic inhalation. In this you have to contract the abdominal muscles with a gentle force, expel the breath quickly, forcefully. Watch your breathing. Slow inhalation, slow exhalation. You have to watch the abdominal cavity as well as the chest cavity. Keep your left palm on the chest, right palm on the abdomen, and just watch. Now you have to do the abdominal breathing. In this, as we inhale, the abdominal cavity should expand. As we exhale, the abdominal cavity should contract, and chest should remain as neutral as possible. So as we inhale, the abdominal cavity should expand. As we exhale, it should contract, which means the right palm should feel the movement of the abdomen. Chest should be reasonably stable, which means left palm should give you the feedback that chest is not involved in any movement with the breath. So it's predominantly abdominal oriented. This is called the diaphragmic abdominal breathing. And even here, as we exhale, try to contract the abdominal muscles a little more than normal. Make the exhalation longer than the inhalation. The inhalation. Now sit upright, palm facing forward, tip of the thumb and index finger in contact. Now we are going to do forced exhalation, automatic inhalation. In this, contract the abdominal muscles with a gentle force, expel the breath quickly, forcefully, relax the muscles, the air automatically enters in. We shall do one more cycle. Relax. Feel that deep calmness within you. We shall do one more cycle. Relax. This breathing helps you to rejuvenate the intestinal muscles and organs. It also has a positive benefit on the nervous system. It brings harmony between the sympathetic and parasympathetic nervous system. It induces a deep sense of calmness. So these are very helpful for the beginners using some of the gadgets like chair. People who are stiff also stand to benefit, especially in the beginning phase. It is important to have a safe mode of practice, and following this method one can not only get a good stretch for the neuromuscular system but also get a great degree of psychological upliftment. So the postures and breathing exercises or techniques are very helpful for the overall development of our personality. Namaste.